Jai Hind. In continuation with our patient general awareness videos of PERIO Subharti, today's video will be on water flosser, types of water flosser, how to use it, when to use it, etc. So in one of our earlier videos, we had already told that twice daily brushing is very essential to keep our teeth and gums clean and healthy. We had covered up the correct method of toothbrushing in that video, which toothbrush to choose and whether to use a manual toothbrush or a power toothbrush. That also has been covered in one of our earlier videos. The links are there in the description. But have you ever wondered that even after twice daily brushing, many of us have some amount of plaque, that is food debris remaining between the teeth and especially in the sulcus, that is the gum area, because these are the areas where our toothbrush many a times is not able to reach properly. So in order to ensure that the areas between the teeth are cleaned properly, we have something known as manual floss. But there are three problems with manual floss. The first and foremost is the technique. It is not easy to master. The second problem is it is time consuming. And the third problem is if the technique is not followed properly, rather than benefit, we might end up injuring our gums. So that is where, as an alternative to manual flossing, we have something known as water flosser. This is also known as dental jet or oral irrigator. So water flosser basically is a device which basically runs the water stream at a very high speed at the tooth gum interface where the tooth is meeting the gum area. So this is supposed to be used after toothbrushing. And which are the types? Let us have a closer look. So these are the two types of water flossers. This is the fixed or the countertop type, and this is the portable or the cordless type. So there are three differences between these two types of water flossers. The first is with regard to the power source. The power source of the fixed type is by an electric cable, while this is basically powered by a battery which can be recharged, and the battery usually lasts around 15 days or so. The second difference is with regard to the connection of the irrigator with the main unit. So we have a cord in the case of the fixed type, while in the case of the opposite type, the other type, no cord is seen attaching the irrigator to the main unit. And the third difference is with regard to the quantity of the water tank. We have a large water tank with regard to the fixed type, and we have a smaller water tank with regard to the portable type. So let us now understand how we are supposed to use a water flosser around our teeth. Part of the extra oral demonstration, this is our unit. So this is the irrigator tip which is attached to the unit. We can take it out like this. We can put it back. We can store it here also while carrying it. In order to fill the water tank, first we have to take it out. So we take it out the entire unit. Now this entire is the water tank. Now what we are supposed to do is we are supposed to fill up this thing from here with water. So now I am filling it up with water, plain water we are putting inside the water flosser. So once it overflows, we know that the tank is full. So now it is overflowing. So once it is done, we can actually close it. Now we'll show the demonstration on a model first. The problem with demonstration on a model is lot of sprinkling of water will be there. So that is something which we'll have to bear with. So these are the two controls which are there. First is the power switch. The second is the mode. So there are three modes available. One, we have gentle. It is always advisable to start with the gentle. Then we have regular, that is more powerful. And then we have pulsed, that is on and off. So let us have a look how it is supposed to be applied. In the patient's mouth, in our mouth, we are supposed to apply it at this area basically. This is the area where the teeth and the gums meet and between the teeth. Suppose we start, please be ready for the sprinkling. This is the pulsed mode. So once we have the pulsed mode, this is basically the gentle mode, and finally this is the regular mode. I'll just demonstrate again. So if I am putting it on pulsed mode, this is the regular mode. Then we have the pulsed mode, that is on and off. But can you see, even though this mode is more beneficial, in spite of that, lot of sprinkling is there around the face, around the surroundings, etc. So how are we supposed to use it in the mouth then? Let us have a look. So this was just a small demonstration on how to use a water flosser. Please understand, this water flosser is a supplement to your toothbrushing. This is not a substitute for your toothbrushing. So whenever a water flosser is used in addition to toothbrushing, studies have shown that it is very beneficial for maintaining our oral health. This is especially beneficial in a couple of situations. For example, suppose we are wearing orthodontic braces, suppose lot of prosthetic crowns are there in our oral cavity. Patients of gingivitis, that is gum disease, bleeding from gums, or periodontitis, that is bone loss around the teeth, and especially in patients of periimplantitis, that is bone loss around implants, it is quite beneficial. Another thing that we can keep in mind is that instead of putting plain water, we can always use an antiseptic mouth rinse also in the water tank of a water flosser. How much antiseptic mouthwash to use, when to use, a detailed video on mouthwashes has been done on our channel. The link is there in the description. So if you learned something new today, do like, subscribe and share our video. Our next video would be on types of ultrasonic scalers, magnetostrictive versus piezoelectric. Till then, keep smiling, keep flossing. Jai Hind.